Hi, everyone. My name is Michael Kalachian. I'm a PGY5 in general internal medicine and a master's student in clinical epidemiology. I'm very excited to present this research on the creation of an inpatient diabetes cohort entitled Gemini DM, supervised by Dr. Michael Freilich. We believe that the creation of an inpatient diabetes cohort is important because diabetes is a common medical condition affecting roughly 1 in 7 adults and 30% of patients admitted to internal medicine. And despite this, there's relatively little data about inpatient hospitalizations among patients with diabetes. And therefore, the objective of this study was to create a multi-center database of adults hospitalized with diabetes in internal medicine to describe their characteristics, medication use, and outcomes. To do this, we utilized the Gemini database and compared a number of different identifying criteria, including ICD-10 code, glucose A1C measurements, and inpatient diabetes medication receipt to a gold standard that we defined through physician chart review. We identified roughly 70,000 patients with diabetes in the cohort with an average age of 71 years. And in comparison to all patients in the cohort, there was a much higher rate of hypertension, dementia, coronary artery disease, and baseline creatinine. We looked at the admission diagnoses among patients with diabetes in comparison to all patients in the database and identified that there was a higher rate of admission for CHF at 8.7 versus 5.5%, and pneumonia and a urinary tract infection. Moving to the right column, we can see medication use while in hospital among patients with diabetes. Roughly 40% of patients receive metformin in hospital. DPP-4 inhibitors were the second most commonly prescribed medications at 28.5%, followed by insulin and sulfonylureas. And a relatively small proportion of patients received either an SGLT2 inhibitor at 2.4% or a GLP-1 agonist. In summary, we created an inpatient diabetes cohort and identified the baseline characteristics, admission diagnoses, and medication use among patients with diabetes in hospital. And we believe that the development of this diabetes cohort will allow for further study towards the optimization of diabetes care. Please don't hesitate to contact me at the email below for any questions. I'd like to thank Sinai Health Department of Medicine Research Fund, the Dal Lana School of Public Health for supporting this work, as well as all of my co-authors. Thank you.